Just when you think that they got a hold and control on the flu epidemic, or they've got control of one issue, another one arises very shortly thereafter. So you see here in my title is new flu strain in the US, child deaths up to 133. And so here, CDC warns of a second flu strain across the US. And so this does not sound good at all, because the first one that people were dealing with, it seemed like it was really a very scary situation, and people were worried whether they should get the shot, whether they should stay away from the shot. And then after that incident with the young man that went missing from the CDC, that didn't sit well with a lot of people. So this article is in MLive, Michigan. So I guess it is U.S. and world news from MLive, I guess Michigan Live. um, Associated Press, David Goldman, by Benjamin Raven. The Center for Disease Control and Prevention reports that while flu season is winding down, a second strain is coming that is more severe in younger children and remains more prevalent. So, in an update, the CDC says that the reports of influenza A virus are on the decline, while reports of the influenza B virus were more prevalent. A spokesperson for the CDC told CNN that the influenza B can be just as severe as type A influenza, and that we also know that the influenza B tends to be more severe in younger children. So flu season is getting worse, highest level in nearly a decade, according to a government report released Friday. 1 out of every 13 visits to the doctor offices last week has been for fever, cough, or flu symptoms. As of its latest update, the CDC reports that the flu-related child deaths are up to 133 for 2017 and 2018 flu season. So there were 5 pediatric deaths reported between March 10th through March 17th related to the influenza B virus, and 1 related to influenza A. So during this week, 2.7% of patients visiting a doctor's office complain of flu-like symptoms. In Michigan and most of the Midwest is listed as having low to minimal flu activity, as the CDC's most recent update from the weeks ending on March 17th. So here's a graph, the activity level, where it's its highest. Influenza season week 11, ending March 17, 2018. Okay. Then it shows all in the yellow where it's moderate to low, and where it's minimal is in like more the green. And where it's white, which nothing really is white, that means insufficient data, but nothing is coded in white. All of them have a color coding for the states of who has the highest level. So a little more than a month ago, the CDC, along with the Food and Drug Administration, reported that this year's flu vaccine had been 36% effective. While this number sounds low to some, both agencies reported that this level was better than some might have predicted. In fact, this number was 19% higher than Canada's vaccine and 26% higher than Australia's. And so at this time, the influenza A strain had accounted for 75% of all cases. So 2 Michigan cities ranked among most at risk in the US for flu and influenza. Grand Rapids, Wyoming is listed in a very high at risk group. and Detroit can be found one rung below in the high at-risk group. So it seems as though Grand Rapids, Wyoming, and Detroit are in the higher spectrum. So the Doctor's Report app reports in a news release that it compiles its ranking using data from nearly 1 million doctors across the US. So, however, because of the severity of the season, there had been questions raised about how well the year's flu vaccine worked. The FDA Commissioner Scott Gottlieb said in a news release, although the initial report of 36% overall efficacy for this year's vaccine in the US that has been reported by a colleague at the US Centers for Disease Control and Prevention is better than some might have predicted it. There is still clearly significant room for improvement because influenza viruses can change their genetic makeup rapidly during the course of a single year. Seasonal influenza vaccines are unlikely most other preventative vaccines. And that's the strains contained in the vaccine constantly need to be adjusted based on the viruses that are expected to be in circulation. So it's always a new strain and it has to be adjusted. So they are ever changing rapidly. So that's pretty much the article. So it goes into a whole nother article, of course. So here's this graph right here of the states. It's not here. And this is the article. Strain across the U.S. child deaths up to 133. Like, comment, subscribe, give me your thoughts, and hopefully you can stay safe. Nobody will have to end up with any more flu viruses, but it does raise eyebrows as to, whether you even trust the vaccine or not, because I think that was a whole topic that was raised about it, especially after the missing worker from the CDC. It makes people ponder, is this shot safe? Is it effective? Is it going to work, or is it going to make us sicker? And those are the questions that are raised. So like, comment, subscribe, give me your feedback, and thanks for listening.